Hi, I'm Dr. Mike Milligan. I'm here with Ralph Laurie. Now, Ralph, of course, you probably know from Casey. He was co-owner of Casey and developer of Casey, sold that, and now he's doing something else. And we're here at the Chicago Midwinter meeting, so there's some noise in the background here, but this is incredible, and you're going to want to hear about this. Ralph, why don't you, thank you for joining us here.
Thank you.
And speak up so that they can hear you over all this noise.
Okay.
But tell us about what you've got here. Practice management from Lighthouse.
Right, it's a practice management extended software product.
Okay.
And mostly everybody in dentistry, virtually 99% of the practices are now computerized.
Right.
And they have some form of practice management system.
Right.
If you take a look, however, at practice management systems, most of those of the most current systems are still over 10 years old. Most of them are 15 to 20 years old.
Wow. Okay.
And as a result of that, they're legacy. And a lot of the processes are computerized, but they're not automated.
So you mean there have been some updates since the last 10 years in computers, huh?
Yes.
Okay, well, let's talk about it.
And what happens is that what we do is we take a look at a lot of those old systems,
okay,
and we've created a product that actually uses the data that's been collected
from those systems. Okay.
And every 10 minutes our servers log on to the different computer systems and look for activities that have occurred that we can take action on.
Okay.
And we call that practice management extended.
What kind of action are we going to take?
Oh, we're going to take save the date email for new patients. We're going to send out new patient packets automatically. We're going to generate patient surveys. We're going to generate emails, text messages, postcards, letters for reactivation. We're going to collect surveys and send them to search engines through our rated data search engine optimization software products that we have.
Okay.
And we do this all automated, so that
this sounds great.
The practice does exactly what they used to do. They pick up the phone, they answer the telephone, and as soon as they appoint the patient, that's the last time they need to touch that patient to get them in for the appointment. So, and then we will do automated outbound phone calling to confirm their appointments. If they do not have an email address, we will send them postcards. When a patient begins to become inactive, we send them out reactivation letters.
So you can do email, text, postcards, all through
letters,
the system.
Right, letters, automated phone calls.
Okay. Now, you know, there's some other systems out there that come to mind, and but with Ralph, of course, the credibility of Casey, and that's an awesome system. I've got that in my office. But so you think this one is by far the best?
Well, I think so, and the reason is it's simply comprehensive.
Okay.
If you take a look at, and certainly all the other products that are out there do what they do well. Okay. The problem is that we've solved is that they only do a portion of communication, and communication is far more than just electronic. If you are wildly successful in your practice, you're going to collect maybe 70% of your practice emails. Okay. Well, if you have 2,000 patients, that means that you're communicating at best with 1,400 of them. What do you do with the other 600? Right. If you're using the other competition, you're doing the postcards, you're generating the letters, you're generating the outbound phone calls.
A lot of staff time, a lot of missed follow-up, that type of thing.
Exactly right. You can't keep up with it because there's simply not enough time. Right. So what we're doing is we're collecting all of the communications, and we're providing the communications what I call in a strategic format. If a person has an email, certainly they get the email. Right. If the person has text messaging, they're going to get a text message. Okay. However, if they don't respond or if they don't have something, we then take the next strategic way of doing it. Would be an outbound automated phone call or a subsequent postcard. Okay. One of the things that we also need to do is we need to do direct mail marketing if you're interested in getting new patients to your practice.
So you do the direct mail marketing?
No other company in the entire space does integrated direct mail marketing like we do.
Okay. I've seen some of the postcards, and they're very nice.
We create our own website. When we generate a direct mail marketing piece, that goes out to several thousand, 1,000, 2,000 patients or prospective patients. We measure how many hits you get to your website, because every website has a landing page that is identical to
landing page.
That's right. Gotcha. And so we know how many people have gotten the postcard, how many people responded to your website, and so then we also track the inbound phone call to your practice. We can measure how many people.
You do that with a phantom phone line or something?
Yes, we do. It's called, we call it phone whisper, so that when
What is phone whisper?
Well, that's a good question. When a person responds to a mail piece or to a postcard, and the phone is answered by your dental team, it whispers in the dental person's ear the purpose of the phone call. So we know before that this is going to be a direct mail marketing campaign phone call, and you then put your
hat on for that direct mail person.
Exactly right.
You know, you've got a potential new patient on the line, so pay attention.
So if you take, and it's often been said, if you can't manage, or if you can measure it, you can manage it. So what we're looking at here is when that phone call comes in, if we've scheduled, or if we've had 50 phone calls that month and only scheduled one patient, there may be a disconnect in how we're handling the call to getting the patient scheduled. So we actually record the inbound call so that you can use those inbound calls for training purposes.
You record the inbound call?
Yes. Now that's optional. You don't have to do it. But
I've seen that occur, and it was really eye-opening.
It can be.
It can be very eye-opening. So
if
you haven't done that,
the main thing is that you need to have your team understand that the purpose of recording these calls is not for penalty, but to ensure that you're
improvement.
Yeah,
improving the practice.
Most of the time, when a patient doesn't appoint, it's because they're not asked. And the amount of times and the amount of calls that we listen to that never comes up, and the patient ends up hanging up, calling in somebody else who does ask for the appointment. It's amazing.
Yeah, so this is a great monitoring, tracking device, but also very educational then for the staff person and the doctor.
Absolutely.
So that the staff person can help themselves or be helped.
Absolutely.
In order to improve.
There's one last thing, and I know we don't have a lot of time. Can you guys hand me the little analytic sheet, the to-do today task list?
Okay.
Right there, the to-do today task list. This is something that's totally unique to us as well. Every morning, 3 o'clock in the morning, we go in to analyze the existing patients that are coming into the practice today. And we give you a synopsis of what you need to collect on each patient. For example, I was 17 when I came in last time. I'm now 18. It says collect HIPAA form. It says you don't have an email address. It says you need, oh, by the way, happy birthday, because it's your birthday. It tells me that...
So this is all on there?
It's all on here and tells you what to do. And it tells you what to collect and what information you need. It says that you are part of a family, 2 of which haven't been in for a recall. So it reminds you about that. And oh, by the way, did you pre-medicate this morning? At the end of the day, we analyze what you should have done and what you actually did. And we give you a synopsis. This is called the Practice Accountability Report. It says you should have had 12 email addresses. You didn't get 12, you got 6, and these people still need to have emails taken on them.
Great.
So it's a pretty comprehensive system, and frankly, I'd pay a year's service for anybody else who can find what we do in any of these other systems.
Pay a year's service. Now, let's talk about that. Would you like to mention the price here?
Sure, it's $199 a month.
For all of this?
For all of this. Now we do, when we send out postcards, there is a media fee for that and postage, which is typical for just about anything, but it's $199 a month for our fees here, and we are the only company that does not have a contract. We go month to month. If we can't prove ourselves to you every month, we don't deserve your business.
Wow. That's
just the way it is.
So
I often ask.
Give us a try. Huh?
Yeah, I often ask doctors, how many contracts do you have with your patients? And you have to be good, and if you're not good, you don't get it.
You'd suggest, and just another minute or two, you'd suggest giving it how long to really get a good feel for this service?
In order to do everything, to go through the cycle, a minimum of I would say 6 months.
You want to give it at least 6 months.
Yes, and you know, it's totally up to the doctor, but
sure.
it's really, that's the cycle.
Okay. And how do we find out more information? Do you have a website?
Yes.
I would think you would with what you're doing. So what's the website?
The website is www.justsaypleaseplz. That's justsayplz.com.
Okay.
And you can reach us at 888-427-5454. Log on to our website.
Okay.
I've got you know, complete information about what we do. We even have a few webinars on there that you can listen to. So it would be it's very entertaining and informational.
Great. Ralph, thanks so much.
Thank you, Mike.
Appreciate it.
All right.
Okay.